Hi, my name is Justin Price and I'm the creator of the biomechanics method, which provides exercise solutions for people in chronic pain. This is another one of my favorite corrective exercises, and it's called lunge with knee pull. Now, when you progress from your myofascial exercise to your stretching to your strengthening, your ultimate goal is to teach muscles how to lengthen under load, so eccentrically, to resist the forces of gravity. What that means is that the muscle, as you say, do a lunge or a squat, you're fighting gravity and you're not winning. That's why your ankle's bending, your knee bending, and your hip bending. But the muscles slow down the forces to those structures of the joints of the hips, the lower back, and the knees if they lengthen effectively. So the gluteus maximus muscle, for example, we're taught in traditional anatomy textbooks that they extend the hips and externally rotate the leg. They do that if you're looking at a person dead on a table. What happens in real life is the glute maximus slows down the hip as it flexes, and when the hip flexes, the leg's internally rotating because the foot is pronating. So the glute maximus comes from the pelvis and spine, across the hip, down the IT band, and attaches to the lower leg. So when the foot pronates, the lower leg is going that way, and if the torso is rotating correctly, so if you've done the torso rotation exercise that we talked about before, now the torso is rotating correctly, and the obliques, which attach to the pelvis, are helping pull the pelvis back. Now your butt will load, because that muscle is lengthening. Your lower leg's going that way, and your pelvis is going the opposite way, which puts a stress on the glute maximus, which slows down the leg as it internally rotates, and slows down the pelvis and spine as it moves. So getting the glute max to work eccentrically in a lengthening fashion decelerates stress to the foot, ankle, knee, hip, spine, shoulder girdle, and so forth. So this is an awesome exercise once things are working correctly to help decelerate forces to the body. Can you show us the lunge with knee pull, Ryan? So he's in a lunge position. Don't go too deep into it if the client's not loosen their glutes. You would use the baseball on the gluteal complex. If when they try to rotate, their knee comes with you, so let go. If the leg goes this way, we know their IT band's tight, so we loosen their IT band. Pull the knee now across, Ryan. He's good because his knee is going that way and his torso is rotating this way. So now we're loading the glute. This is really working hard. If we see that his torso doesn't rotate, we regress to the lying rotations to help rotate the torso, which will pull the pelvis back to activate that glute. If the calf is tight and his knee can't come forward, we would regress to the Bosu stretch for the calf, which would also help load the soleus. Let's see this from the other side, right? So just face that way. So he's pulling the knee across, which will move the origin of the glute max that way. The rotation of the torso pulls the origin of his glutes away from his knee. This is a very stressful exercise if there is any dysfunction in his body. So you look at where he has, if he's not turning, if his hip is not loading correctly, the knee's not going in, and regress it to one of the other exercises we have used previously. So thank you, Ryan. I would perform that isometrically at the beginning. You would progress that to where it becomes a stepping exercise, so it becomes dynamic. You would regress that by using a balance aid or something to take away some of the demand to all those muscles. Once the person can do that very well, you start to give them repetitions, maybe 10 to 12 a day, to really start to load that gluteus maximus eccentrically to decelerate all sorts of forces to all the structures of the body. And that is the lunge with knee pull.